Molly, registered dietitian and certified diabetes specialist at Form Health. November is National Diabetes Month, and this month I'm going to be sharing some tips and tricks, some recipes to help support those who may want to manage their blood sugars or improve their overall health. Tip number 1 this month is all about knowing what foods impact your blood sugars the most. Food is made up of protein, carbohydrates, and fat. Carbohydrates have the biggest impact on our blood sugars. That being said, you don't have to avoid carbohydrates in order to keep your blood sugars in check. It's all about the quality of carbohydrates you're consuming and the quantity of carbohydrates you're consuming. So there are 2 types of carbohydrates. There are our simple carbs, also known as our carbs without fiber, and then there's our complex carbs, those with more fiber. The simple carbs tend to be digested quicker, which makes us have a higher blood sugar spike, and then we tend to have a kind of a crash later on, which can make us feel hungrier, tired, and more likely to want to continue to eat that simple carb that we just consumed. Complex carbs are those that are going to have fiber. Fiber digests slowly, which is beneficial because it keeps us fuller longer, and it doesn't impact our blood sugars after a meal as much. Today I'm going to share a list with you of complex carbs and simple carbs. The goal is to focus more on that list of complex carbs and what you can add to your meals, and really look at that simple carb list and figure out how can I reduce the amount of simple carbs to help control my blood sugars. Remember, diet, exercise, and overall lifestyle changes can really make an impact on your blood sugars.